Hi everyone, this is Dr. Susan Brown at the Center for Better Bones. Today we're going to take a deep dive into this question of bone health and using bone drugs, and particularly talk about a client I just saw who had a fracture while using Fosamax. And I'm going to give you some hints how, if you are using bone drugs or you know someone who is, how you can prevent a fracture while taking these drugs. One of the really tips you should know for preventing fracture if you're taking those drugs. Now, here at the Center for Better Bones, it's our total mission, and it's been our mission over the past 30 years, to help people maximize their bone health naturally with lifestyle, nutrition, an alkaline diet, exercise. But that's not to say there's some people that choose to use bone drugs or maybe have to use them because they can't do a holistic rebuilding program. The long and the short of it is that when I wrote this book, The Better Bones, Better Body, the first edition, I researched it 25 years ago. And at that time, Fosamax was just coming out. Fosamax is the most popular bone drug still today, and it is a drug that halts bone breakdown. Most of the bone drugs we know halt bone breakdown. And so this client I'm going to tell you about is now 67 years old, and many years ago, maybe 7 or 8 years ago, the doctors gave her this Fosamax drug. She took the Fosamax drug right along, and she was doing okay. But then at one point, somewhat recently, she falls and she breaks a vertebral body. She has a fracture in her spine. It was kind of upsetting to her because she was on the drug that was supposed to prevent fractures. And that is actually considered a treatment failure if you fracture while on a bone drug. Then they sent her to physical therapy. In physical therapy, the physical therapist had her do some exercises, strength training, and it caused another fracture. Sitting right there, doing his exercises, she fractured another vertebral body. So by that time, she said, nah, I think I'm going to stop doing this drug, and I better be very careful with my change physical therapist. And so she came to see us, said, well, can you help me build bone naturally? So we set out on our program to help her. But when we were analyzing the case, and the first step always in the Better Bones, Better Body program is to assess the case to see what's really happening. When we looked at her case, we saw that actually months before the fracture, her doctor had actually tested her bone breakdown. Now, I've spoken before about bone breakdown tests. Let's kind of take a second and look at this. So this drug, Fosamax, halts bone breakdown. The argument is you lose bone because your bone breakdown's too high. You're breaking down more bone than you're building up. So they had her on a strong bone breakdown drug, and the doctor, perhaps, I don't know, he probably wanted to see if the drug was effective. If the drug is effective, your bone breakdown goes down. Her bone breakdown went down when I looked at this test, but it went down too low. They happened to use the CTX test. Remember, if you studied my work, there's a bone breakdown marker called CTX, C-tylopeptides, and one called NTX. It doesn't matter which one you have. And if you want to be refreshed on this, you can look at our medical workup for osteoporosis. It's on betterbones.com. It lists all the tests that you should have before you even consider taking a bone drug, and it includes these markers of bone breakdown. The woman's on Fosamax, I don't know, 6, 7 years. She has a fracture, but before the fracture, the doctor measured the bone breakdown. The CTX in her case was 157. Now that caught my eye because 157 is a very low CTX. It's a low bone breakdown. And in fact, people on bone drugs might have a 300 CTX. And if you're not on bone drugs and you have too high bone breakdown, you may have a 500 or a 600. This woman took the drug. She got a very low CTX, 157. And the thing that's interesting is the doctor should have known, and perhaps he didn't know, that anything below 200 on CTX means that you're at very high risk both of necrosis of the jaw, which is a rotting of the jaw. When a tooth is pulled out, the jaw can't recover and the jaw tissue rots because the bone is so unhealthy. And this low CTX is also associated with these needless fractures of the upper leg of the femur. I've had clients that just be on these drugs for many years, just turn and fracture a leg. So my point here is that a person on these drugs should have their bone breakdown marker tested. If it's extremely low, if the CTX is below 200, as these researchers document, it means you're at a very high increased risk for needless fracture from this drug. My concern in this case is this woman had no idea what the CTX test meant. She didn't even know her doctor did this simple blood test for CTX. But when we looked back, I suspect the doctor himself didn't even know how to interpret that test properly, because he would have known that not only did they halt bone breakdown, which might be a good thing, but they halted it too much, which is a bad thing. So the bottom line to all this is know your bone breakdown marker if you're on a drug that halts bone breakdown, and don't get it too low. Remember that bone breakdown is always in balance with bone formation. The body is constantly breaking down old pieces of damaged bone, building new. If you try to halt bone breakdown, bring it down, you're going to halt bone formation. They go together. And so we prefer naturally to try to halt bone breakdown and stimulate bone formation naturally. If you force it with drugs, you're going to see that you reduce both bone breakdown and bone formation. Okay, so learn about bone turnover markers. They're really helpful. And let's see. Oh, we have a little question here. At what age should we get tested? Now, these bone breakdown markers, in this case I'm talking about, the person was on a drug that halted bone breakdown, so you want to make sure it's not too strong of a drug. It's not halting bone breakdown too much. So you would do that anytime you were on a bone drug that halted bone breakdown, like Fosamax or Rayclast or Boniva or any of those. Now, this question a person asked, at what age should we be tested? I suspect they're asking, at what age should a person not on bone drugs get a test for bone breakdown? Now, that's a great question, because if a young person, say you're a 30, 35-year-old woman, if your bone breakdown is too high, you know you're undergoing accelerated bone loss too early in life. On the other hand, during menopause, during that menopause transition, the average woman, as I've told you many times, loses 10% of her bone mass from the first year before the last period to 5 years after. If you're in that window around menopause or just before menopause, great to get a marker of bone breakdown, either the NTX or the CTX, because you can see how rapidly am I losing bone, and more importantly, with my natural program, can I slow down that rate of bone loss? It's very difficult to halt menopausal bone loss, that bone loss around menopause, but you can certainly slow it down with exercise, proper nutrients, and the proper support to quiet down the bone breakdown. Good question. When you get older, like beyond menopause, you want that, when you're 60s, 70s, you want that bone breakdown again to quiet down to a lower level. And you can watch the changes over time. It's not an expensive test, it's a handy test to do. Okay, be well. We'll talk more about